A lot of treatment is widely viewed upon as good. Non-steroidal anti-inflammatories come to mind. They're littering the commercials on TV
Oh,
and targeted toward the person with the symptoms. Injections, surgery, those are. Hey, I've seen the picture myself. I saw where it's arthritic or where there's degenerative changes there. It makes sense. The doctor's got to stabilize that. Um, what's the problem with those other treatments?
they're not based on a precise diagnosis. They're they're guessing games. I see it, educated guesses, but nevertheless, they're guessing because they don't know for certain that they have a diagnosis. They they will talk about a diagnosis, but until they try their treatment out, they don't know if they've got something of value. And so many people with that have a diagnosis, the treatments aren't effective, and so it's real cloudy as to whether the diagnosis is accurate and whether the treatment for the alleged diagnosis is appropriate. And so uh, that's the beauty of MDT, is that you can make a mechanical diagnosis that explains the pain and gives you the solution to the pain. That's the definition of a precise diagnosis, one that has a predictably effective treatment
Mm-hmm.
associated with it.
Yeah. The physicians will have palpatory testing. They'll have some neurological testing to see if there's any deficits there. They'll use imaging, of course, to help contribute some data toward finding a diagnosis. You talk about a reversibility testing. What is that? And just explain a bit of what the book talks about in terms of that. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.